Well, absolutely. Ravira, I want to ask you this. There was this discussion in our newsroom essentially about this entire breaking news, and we were obviously thinking if this is some publicity stunt or not. And when we did go to the story, we did say that her manager claims she's passed away. India Today has not been able to independently verify, and we said that repeatedly. So we were responsible in our reportage. I want to ask you, the discussion that we were having was that life is fake. Those who in fact are just living and dying for publicity can do all kinds of things. That a celebrity's death announcement has come as a shock, not because we are, of course we were upset, we were feeling bad about this entire episode, but we were in disbelief because of the image that influencers have created for themselves, that they could just be doing anything for publicity and money. Ravira, isn't this tragic?
I think this is very, very tragic that you stoop to this level, that you fake your own death just for traction on social media. I'm sure her engagement rate today on social platforms must be too high, but is it really worth it? That's what, we have to draw a line between actually promoting, influencing. And this is way too low of a level of any kind, because now, God forbid, if something actually happens to her, I think the entire India is not going to believe her. And that will be more tragic towards her. So I really feel that the influencer should draw a line between understanding that, there is a level to which we can influence, and we should, and money should not really pave your way towards such sort of publicity stunts that, you regret it for the rest of your life.
Yes, Dr. Vidya Bhatt, I want to ask you, a lot of people on social media, since this generated a lot of chatter on social media, have spoken about the fact that, we've lost our father, we've lost our mother, we've lost our sister, brother, loved one to cancer. And this was absolutely not cool. To survivors of cancer or to family members who've lost their loved ones because of this dreaded disease, really, this was terrible, wasn't it, Dr. Bhatt?
Yeah, it is terrible to lose somebody loved and who has been with you for some cancer. It is a terrible thing, but let me highlight that cervical cancer, when identified or when diagnosed early, has 100% survival rate.
Absolutely.
Especially I'm talking about stage 1. And surgical treatment, we have had so many patients who have undergone surgical treatment at stage 1 and stage 2, and they are doing exceptionally well when they come for follow-up. So when you say that a patient has died of cancer, it should be either a very aggressive disease, that means which will progress very fast,
yes,
and it may not even respond to any kind of treatment.
Okay.
That is any kind of radiotherapy, chemotherapy. So that kind of aggressive cancers are comparatively less as you see the general cancer. So when you take 100 patients with cancer, the aggressive ones may be just 15 to 20%.
Okay.
But 80% of the time, we are able to give them a quality life, a treatment for their disease, and some become completely, like breast cancer identified early, CA endometrium, which is all identified at an early stage, can be treated. Any cancer concerned to female genital organs. The same thing goes through even male cancers like prostate, kidney, and liver also. To some extent, we are able to sort of treat them.
Okay. Dr. Bagmar, I want to ask you that, some people may actually just turn around and say that, okay, forget about the publicity aspect of it. You are discussing cervical cancer, aren't you? So what's wrong? We're all discussing cervical cancer. The fact of the matter is that it generated a buzz around the disease. So do you feel somewhere, deep down that maybe it did in a way at least generate a conversation around cervical cancer? Because I'll tell you, there is a stigma attached, there is less awareness around cervical cancer. Most people don't even know that there is a vaccine for cervical cancer that can, or cervical, to prevent HPV infections. And cervical cancer, of course, is a result of an HPV infection. So there is chatter around it. That chatter was what was really required. You as an oncologist, do you believe that has been achieved in a way?
Yes, in a way, yes, it has achieved some chatter. Like basically cervical cancer is a cancer of rural India. So it is not usually seen in the urban cities. Very few patients come from the urban places or affluent places.
Okay.
So that's why it has not got that publicity as a breast cancer, which has got the publicity as such. So rather than giving the further air to this stunt, I would like to use this platform that every girl child, she should get a cervical cancer vaccine between 9 to 14 years, as it is approved, and it is almost 99% preventable. So this is a cancer which is caused by HPV virus, and that is preventable 99% of the times. And in fact, even if the girl child is more than 14 years of age, so from 14 years to 26 years also, it is very useful. And in fact, at AIMS, where I did my studies, there a study was done that even if the benefit reduces, it can be given till 45 years of age. So even when I was studying, I got my cervical cancer vaccine at the age of 33. Whatever benefit it gives, I took that time. So this is how. So it should be given between 9 to 14 years. And in fact, in US and in Western countries, it is also given to boys as well.